the webinar. The slide has the logo of the Tennessee Disability Coalition and Family Voices of Tennessee. And the title of the slide is Effective Communication Equals Access to Healthcare Services. The protections and safeguard of Title III of the ADA. I'm Julie Sullivan, and I've been with Family Voices for 14 years, and I'm a parent of 2 adult children, both who have their own special healthcare needs.
I'm Donna DeStefano, the Assistant Director of the Tennessee Disability Coalition. The coalition is the Tennessee state affiliate of the Southeast ADA Center. The ADA centers have the nationwide capacity to respond to emerging issues around the Americans with Disabilities Act.
Okay. Slide 2. The title of the slide is Training Objectives. Today we want you to learn about the Southeast ADA Center and its state and local affiliate network. Learn about Family Voices National and Family Voices of Tennessee. Increase knowledge about the Americans with Disabilities Act, ADA. Understand the obligations of private healthcare providers to comply with the ADA Title III. And learn about effective communication in healthcare setting for people with various types of disabilities and families and caregivers. And learn about available resources and tools.
Oops. Let me see, I need to advance the slide. Whoops, wrong way, sorry. Slide 3, the title of the slide is Disclaimer. The Southeast ADA Center is funded by the National Institute on Disability, Independent Living and Rehabilitation Research, also known as NIDLR, to provide information, materials, and technical assistance to individuals and entities that are covered by the Americans with Disabilities Act, ADA, under grant number 90D P00190100. NIDLR is a center within the Administration for Community Living, ACL, in the Department of Health and Human Services, HHS. The information, materials, and/or technical assistance are intended solely as informational guidance and are neither a determination of your legal rights or responsibilities under the Act, nor binding on any agency with enforcement responsibility under the ADA. The Southeast ADA Center does not warrant the accuracy of any information contained herein. Any links to non-Southeast ADA Center information are provided as a courtesy and are not intended to, nor do they constitute an endorsement of the linked materials. You should be aware that NIDLR is not responsible for enforcement of the ADA. For more information or assistance, contact the Southeast ADA Center via its website at adasoutheast.org or call 1-800-949-4232 or 404-541-9001. Slide 4. The title of the slide is The Commercial. There is a picture of a man with a sign over his body. The text on the sign reads, Southeast ADA Center, Family Voices of Tennessee, Tennessee Disability Coalition. Slide 5. The title of the slide is the ADA National Network. The ADA National Network logo is pictured. There is also a picture of the map of the United States divided into the 10 ADA centers. The ADA National Network is a network of 10 regional ADA centers across the United States with over 2,200 affiliates at the local, state, and regional level. They're funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, NIDLR. The toll-free number, 1-800-949-4232. Slide 6, the title of the slide is the Southeast ADA Center. The Southeast ADA Center logo is on the slide. There is a map of the 8 states in the Southeast ADA Center area: Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. The Southeast ADA Center is one of 10 regional centers in the ADA National Network, funded since 1991 by the National Institute on Disability, Independent Living, and Rehabilitation Research, NIDLR. It's a project of Burton Blatt Institute at Syracuse University. The contact information for the Southeast ADA Center is on the rest of the slide and in the accompanying materials.
Slide 7. The title of the slide is Family Voices family-to-family health information center and has the Family Voices logo. Each state has a family-to-family health information center, and we're federally funded to provide services to families of children and youth with special health care needs and/or disabilities. We assist families as they navigate public and private health systems and insurance plans, including TennCare and commercial plans. We educate families how to access services and resources for their children and help get healthcare providers. Educate families about how to access services and resources for their children and how to work with healthcare providers. Listen to families as they describe their encounters with health systems and help guide them to possible solutions. Work with families, healthcare providers, public and private agencies, and advocacy or support groups to promote family-centered care and medical homes for children with special healthcare needs. Promote discussion and linkages among families, providers, managed care programs, government, and to better serve the healthcare and related needs of children and families in Tennessee. Slide 8. The title of the slide is Family Voices of Tennessee. And Family Voices of Tennessee logos there, and pictures of families of Tennessee, Family Voices of Tennessee and staff and their families. Family resource specialists are parents of children with special health care needs, and the families live across the state and work in the communities that they serve. They work with families to find opportunities for the families to be at the table, such as councils and committees that focus on children with special health care needs. Slide 9. The title of the slide is Tennessee Disability Coalition, and it has the Tennessee Disability Coalition logo. The Tennessee Disability Coalition is an alliance of organizations and individuals of Tennessee that have joined to promote the full and equal participation of men, women, and children with disabilities in all aspects of life. It's an affiliate of the Southeast ADA Center.
Slide 10. The title of the slide is the Americans with Disabilities Act of 1990. There's a picture of scales at an even level. The ADA is a broad civil rights law. The origins are in the Civil Rights Law of 1964 and the Disability Rights Movement. The ADA is a national mandate for the elimination of discrimination against individuals with disabilities. The focus is on equal opportunity. The ADA does not guarantee equal results, establish quotas, or require preferences favoring individuals with disabilities over those without disabilities. Slide 11. The title of the slide is Fulfilling America's Promise to Americans with Disabilities. There is a picture of the signing of the ADA on July 26, 1990 by President George H.W. Bush on the White House lawn, with Reverend Harold Wilkie of Claremont, California, Sandra Perino of the National Council on Disability, Evan Kemp, Chairman of the Equal Opportunity Commission, and Justin Dodd of the Presidential Commission on Employment of People with Disabilities. The Americans with Disabilities Act of 1990, ADA, marks a milestone in our nation's quest to guarantee the civil rights of all citizens. President George Bush made the following statement that day, quote, "And now I sign legislation which takes a sledgehammer to another wall, one which has for too many generations separated Americans with disabilities from the freedom they could glimpse, but not grasp. Once again, we rejoice as this barrier falls, proclaiming together, we will not accept, we will not excuse, we will not tolerate discrimination in America." Slide 12. The title of the slide is Titles of the ADA. There are 5 titles of the ADA, and titles are similar to chapters. They are Title I, Employment, Title II, Public Services, State and Local Governments, Title III, Public Accommodations, Private Businesses, Title IV, Telecommunications, and Title V, Miscellaneous Provisions. The focus of the presentation today is on Title III, Public Accommodations, which are private businesses and specifically healthcare providers. Title V includes miscellaneous provisions that are intended to apply broadly across all other titles. For example, the ADA does not invalidate or override any other laws, federal, state, or local, that provide equal or greater protections or remedies for people with disabilities. The title also prohibits retaliation, intimidation, coercion, threats, or interferences with people who seek to exercise their rights or who encourage or aid others to do so. Slide 13, the title of the slide is Title III of the Americans with Disabilities Act, ADA. Title III prohibits discrimination against individuals with disabilities by places of public accommodation. The section of the United States Code is included on the slide and in the accompanying documents for those who may be interested in looking it up.
Slide 14, the title of the slide is Place of Public Accommodation. We're talking about places of public accommodation, and these are what they are. Places include over 5 million private establishments, such as restaurants, hotels, theaters, convention centers, retail stores, shopping centers, dry cleaners, laundromats, pharmacies, doctors' offices, hospitals, museums, libraries, parks and zoos, amusement parks, private schools, daycare centers, spas, and bowling alleys. We're speaking about health care today, and pharmacies are an important area of our children's health care. One of our staff who lives in a rural county uses a mom and pop owned pharmacy, and the natural accommodations of their staff are they take the lead in addressing the young woman with intellectual disabilities. They take cues from her family, who stand back and only intervene if translation of her attempt to be verbal is not understood. The family refer to this as Olivia speak, that those who know Olivia understand her language. And the pharmacy staff have Olivia sign to the best of her ability and give her the medication she signed for. So with the support from all, she has successful communication and interaction. So public accommodation places means something that the public uses. You're serving the public. Slide 15. The title of the slide is Healthcare Providers. Private healthcare providers are considered places of public accommodation. Title III of the ADA applies to all private healthcare providers, regardless of the size of their office or the number of employees. We have included the code for you. In private hospitals, nursing homes, psychiatric and psychological services, offices of private physicians, dentists, healthcare clinics, pharmacists, and home health.
Slide 16, the title of the slide is Religious Organizations or Entities Controlled by Religious Organizations. Religious organizations are exempt from Title III of the ADA. They are subject to employment obligations of the ADA if the facility has 15 or more employees as of July 26, 1994. If they receive federal funding, they're obligated under Section 504 of the Rehabilitation Act to make its services accessible to persons with disabilities. And they may be subject to other federal, state, or local laws prohibiting discrimination and requiring accessibility, such as the state's Human Rights Act. In Tennessee, the Tennessee Human Rights Act and the Tennessee Disability Act prohibit discrimination related to employment, housing, and public accommodations. Under this act, Tennessee employers are subject to the employment obligations if the facility has 8 or more employees. In this situation, Tennessee law provides greater protections to people with disabilities than does the federal ADA law. So Tennessee law prevails. Slide 17. The title of the slide is Communication Methods. There is a picture of a mother holding her young child whose name is Claire and who has cochlear implants. They're watching then Governor Bredesen of Tennessee as he signed Claire's Law, named after Claire, which ensures that every newborn in Tennessee is screened for hearing loss. There are different communication methods that may be used by people whose disabilities impact how they hear, see, speak, read, write, and understand. Slide 18 is titled Effective Communication. Healthcare providers have a duty to provide appropriate auxiliary aids and services when necessary to ensure the communication with people with disabilities is as effective as communication with others. The citation for the federal code is included on the slide and in the accompanying materials. Slide 19 is titled Auxiliary Aids Examples. Some examples are listed and include qualified interpreters, note takers, written materials, telephone handset amplifiers, assistive listening devices, open and closed captioning, qualified readers, audio recordings, braille materials, large print materials.
Slide 20. The title of the slide is Effective Communication. Effective communication is determined on a case-by-case basis, based on the person's needs and the situation. Involves consulting with the individual and/or family to determine what communication method or technology will be effective for him or her. There is no one-size-fits-all. It must be individualized for each person. Slide 21. The title of the slide is, Can you read these medication directions? Line 1 is in Spanish. Line 2 is in French. Just because a message is sent does not mean it is received. If you receive this message, would you be able to follow the instructions? In English, it says take 1 pill at bedtime for 7 days. And this is an example of how important knowing what a patient and family's needs are. Health literacy is important. If you can't understand the directions your physician is giving you, then you're not having effective communication. As families, we need to ensure we understand, and the medical professionals need to ensure this as well. Slide 22. The title of the slide is The Spirit Catches You and You Fall Down. This book explores the clash between a small county hospital in California and a refugee family from Laos over the care of Leah Lee, a Hmong child diagnosed with severe epilepsy. Leah's parents and her doctors both wanted what was best for Leah, but the lack of understanding between them led to tragedy. The communication breakdown that did occur resulted in Leah having more seizures because she wasn't getting the medications by mouth. The Hmong family rubbed the medicine on her several times a day instead of giving it to her orally. So, of course, this didn't help Leah, and she continued to have seizures, and later the hospital staff called in children's services. And it wasn't the family didn't care for Leah, for their child, it's they didn't understand how to provide the care. This is an extreme example, but it does show how important it is for everyone to understand. Slide 23, the title of the slide is Effective Communication. Who? Effective communication is for customers, clients, and other individuals with disabilities seeking or receiving services. Also, spouses, partners, family members, etc. with disabilities. An example would be a child with physical disability goes to the doctor with her mother, who is deaf. The child doesn't need accommodation for effective communication, but her mother does. The healthcare provider would need to provide an accommodation to ensure effective communication, which may include a sign language interpreter.
Slide 24. The title of the slide is Common Scenario, People with Visual Impairments. Often important healthcare-related information is provided in standard print. And this includes lab results, prescription medication instructions, informed consent information, end-of-life policies and procedures, physical therapy instructions and instructions for the management of chronic conditions, childbirth preparation resources, prenatal care materials. However, people with vision disabilities may not be able to read the standard print. Slide 25. The title is Recommendations, Visual Impairments. There is a picture of 3 adults, a man with a cane, 2 women, and a service animal standing in front of them. Healthcare providers need to consider the context, the importance of the information, the length, and the complexity of materials. Slide 26 is also entitled Recommendations Visual Impairments. There are pictures of a person's finger reading a page written in Braille, an example of large print, and an image for qualified reader. The recommendations are use alternate formats, such as Braille, large print, electric format, audio recordings. Another recommendation is to provide a qualified reader. A qualified reader is defined in the law as a person who is able to read effectively, accurately, and impartially using any necessary specialized vocabulary.
Slide 27. The title of the slide is People with Intellectual and Cognitive Disabilities. A picture of a young man with Down syndrome at the state legislature talking with a legislator. People with intellectual and cognitive disabilities may need more time to learn a new task. They may need repetition with precise language and simple wording. And adults should be treated as adults, not children. Example of simple wording: stop, drop, and roll. Very precise, commanding, and explanatory. Those three simple words involve a lot, but they convey the message very clearly. And also allow time for people to process information. Oftentimes, people with intellectual disabilities need a little bit more time to process information. Some may need time to think about what's being said for a while before responding, so give more time to respond to directions. Example of go to the lab. Slide 28. The title of the slide is Recommendations, Intellectual and Cognitive Disabilities. There's a picture of an adult and young child communicating via gestures and signed English. So recommendations of intellectual and cognitive disabilities. Translators, presume competence. Do not pretend to understand if you do not. Ask additional questions to clarify any information a patient may be sharing with you. Reduce distractions. Use pictures or objects to convey meanings if appropriate, and allow wait time for the patient to process information or respond to a question or to make a comment. Not only do folks who are deaf or hard of hearing need interpreters or English second language may need materials translated, those who are like the young lady Olivia that we mentioned may need someone to translate his or her needs, requests, or wants. Often when Olivia speaks to people in her community, she needs a family member or close person to translate what she's saying. She's very verbal, but extremely hard to understand. She and many of her friends even have scripts they must go through before they can focus on anything else. So this may be going over a favorite topic or a series of questions. Help medical professionals understand they must go through these scripts before the person with intellectual disabilities can focus on another topic. Slide 29. The title of the slide is People with Speech Impairments. We have a picture of three adults talking about communication devices on a table. People with speech impairments often use alternative or augmentative communication, AAC. Use forms of communication other than oral speech that are used to express thoughts, needs, wants, and ideas. And included in material is a link on this. Patience is the key to communicating with anyone, adult or child, who has a speech impairment. Always let the person finish their sentence. Not only is it rude to cut someone off, but it's also discouraging as well. Be honest if you do not understand, but also be polite in your honesty. If they have a particular difficulty communicating, you can ask questions that require a gesture, such as a nod, or a short answer rather than long ones that may be difficult to articulate. Some people with speech impairments find the impairment more pronounced when stressed. And if one is sick or not feeling well, this will mean increased stress and can lead to communication difficulties. Such as going through a script may be comforting for a person who is sick, or stuttering may be more pronounced if the person is in pain or scared. Some individuals with speech impairments may choose to use a notebook so they are able to write down questions prior to an appointment and share with their provider in that manner. Slide 30, the title of the slide is Alternative or Augmentative Communication, AAC. Emojis are pictured, one with hands raised above the head and another smiling and winking. Alternative or augmentative communication. We all use AAC when we make facial expressions or gestures, use symbols or pictures, send text or write messages. Slide 31. The title of the slide is Recommendations for Speech Impairments. There's a picture of adults sitting at a desk with an interpreter next to one of the adults. Recommendations of speech impairments allow individuals to use their speech synthesizers, communication boards, provide sign language interpreting, provide access to a laptop, keyboard, tablets for typed communication. The Steve Gleason Act of 2015, this amends a Social Security Act to provide Medicare beneficiaries with access to eye tracking accessories for speech generating devices and to remove the rental cap for durable medical equipment under the Medicare program with respect to speech generating devices. This may be beneficial for families of children who are accessing Medicare through their parents.
Slide 32. The title of the slide is Scenario for a Patient Who is Deaf. There's a picture of a patient in a hospital bed with a doctor and a nurse talking with him. The patient was prescribed a medication and requested an interpreter, but that wasn't provided. The patient didn't understand the medication directions and was subsequently hospitalized after having a heart attack. And the source of this scenario is the Medical Interpreting Task Force in Washington State. That task force is for people who are deaf, hard of hearing, and deafblind in the state of Washington and was convened in the fall of 2012 in order to address increasingly serious concerns expressed by stakeholders who are deaf. Slide 33, the title is Common Scenario for Patients Who are Deaf. Some common scenarios include healthcare professionals asking sick children to interpret for their parent who is deaf, pressuring a man who is deaf to lip read and interpret for his wife who is deafblind, and ignoring requests, including repeated requests, and relying on writing notes. Slide 34 is entitled Recommendations, Deafness, Sign Language. There's a picture of people in a group with one of them signing. The recommendations include use a qualified sign language interpreter, use interpreters who are trained in medical technology, and do not use family members. There are various kinds of interpreters: American Sign Language, Signed English, Cued Speech, etc. The healthcare providers should determine the particular language needs of the patient who is deaf or hard of hearing before hiring an interpreter. Family members are not qualified interpreters because they usually cannot remain impartial. Additionally, they often do not have the language skills or training to effectively and accurately interpret the medical information. Using family members may also be a HIPAA violation. Slide 35 is entitled Qualified Interpreter. There's a picture of a patient in a hospital bed talking with the doctor, and an interpreter is also there. The definition of a qualified interpreter is an interpreter who, via video remote interpreting, VRI service, or an on-site appearance, is able to interpret effectively, accurately, and impartially, both receptively and expressively, using any necessary specialized vocabulary, including sign language interpreters, oral transliterators, and cued speech transliterators. The section of the code is also listed on the slide in the accompanying materials. I want to make a note that the ADA definition does not require interpreters to be certified. State laws and regulations may impose additional requirements for interpreters, however. And the law that offers the greatest coverage and protection for people with disabilities is the one that applies. Slide 36 is entitled Video Remote Interpreting, VRI. There's a picture of a patient in a doctor's office talking with the doctor. There is a small screen with a remote interpreter across from the patient and next to the doctor. Video remote interpreting is defined as an interpreting service that uses video conferencing technology over dedicated lines or wireless technology, offering high-speed, wide bandwidth video connection that delivers a high-quality video images as provided in section 36.303F of the code. The link to the ADA regulations for this is also included on the slide and in the accompanying materials. VRI works well as long as the patient is in a position to see the video. If someone is in severe pain and doubled over, the person cannot access the video for it to be effective. And the interpreter may not be able to see or understand what the patient is saying in order to interpret.
Slide 37. The title of the slide is Communication Access Real-Time Translation Transcription Service, CART. CART is for individuals who are deaf but do not rely on sign language for communication and who have good levels of reading comprehension. We have included the code for you. CART converts spoken words instantly into text using a stenotype machine, computer, and special software. Family Voices has used the CART system for our Family Voices conferences in the past. Slide 38. The title of the slide is Communication Access Real-Time Translation Transcription Service, CART. And there's pictures of CART, one at a table in front of a person, another in a large conference room session. These are ways CART is delivered. The first picture is working with an individual, and the second is in a large group setting where everyone can see. This is good for people who don't process well auditorily and have access to a visual. It's more likely used in a conversational type appointment. Slide 39. The title of the slide is Recommendations for Emergencies, Urgent Care, Deaf, Use of Combination On-Call Interpreter and VRI. VRI is Video Remote Interpreting. Ask the patient about the most effective means of communication, their preference. If requested, call the on-call interpreter, if possible, using the VRI to get the initial patient information. This exception source was Medical Interpreting Task Force, Washington State. This is an emergency situation. Ask the patient about the most effective means of communication, if possible. The healthcare provider makes the call as long as it's equally effective given the situation. There are exceptions. This is an emergency. Exceptions regarding using an adult. If the emergency involving is an imminent threat or to the safety or welfare of the individual or public where there is no interpreter available, or if the individual specifically requests that an accompanying adult provide the interpretation, the adult agrees and reliance is appropriate. Exception regarding using minor children can only be used if the emergency involving an imminent threat to the safety or welfare of the individual or the public where there is no interpreter available. Slide 40. The title of the slide is Recommendations, Simple Solutions, Deaf, Brief Exchanges, Basic Aids. There's a picture of note paper, pen, and cell phone. So the recommendations include exchange of written notes, use a smartphone to write and exchange messages. For brief or simple face-to-face exchanges, very basic aids are usually appropriate. For example, exchanging written notes may be effective when a deaf person asks for a copy of a form at an office or ordering food at a hospital cafeteria. For more complex or lengthy exchanges, more advanced aids and services may be required. Consider how long the communication is, how many people are involved, and the length of the communication anticipated and the context. Slide 41. The title of the slide is Recommendations, Complex Situations, Deaf. Pictures of the person talking and sign language interpreter next to her, and one of a cart per individual at a table. For interviews, counseling sessions, community events, meetings, etc., the use of an interpreter, sign language, oral or cued speech, or a cart may be appropriate. Would be too much for text this would not, if it's too much for a text, that's not a simple exchange. So situations where it involves a lot of information, you really need an interpreter or CART, that type of system.
Slide 42, the title of the slide is Costs, and there are $3 signs on each side of the word costs. As long as the provision of the auxiliary aid or service does not impose an undue burden on the provider's business or is a fundamental alteration in the nature of the goods or services provided, the provider is obligated to pay for the auxiliary aid or service. The costs should be considered a part of the overhead costs of operating a business. The settlement agreements negotiated with the United States Department of Justice are really clear. Being reimbursed less than the cost of services for a sign language interpreter is not considered an undue burden. Additionally, a healthcare provider cannot charge a patient for the costs of providing auxiliary aids and services, either directly or through the patient's insurance carrier. Slide 43, undue burden and fundamental alteration. Undue burden means a significant difficulty or expense. There are many factors that are taken into account when determining when an action would result in an undue burden. For instance, one consideration is the overall financial resources of any parent corporation or entity. The definition of a fundamental alteration is a change that is so significant that it alters the essential nature of the goods, services, facilities, privileges, advantages, or accommodations that are offered. Slide 44. If there is an undue burden, then the healthcare provider still needs to the healthcare provider still has a duty to furnish an alternative auxiliary aid or service, and to the maximum extent possible, one that would ensure effective communication. The title of the code is on the slide and in the accompanying materials. Covered entities may require reasonable advance notice from people requesting aids or services based on the length of time it's needed to acquire the aid or service, but they may not impose excessive advance notice requirements. It's also, walk-in requests for aids and services must also be honored to the extent that is possible. Slide 45 is entitled Tax Credits for Private Medical Offices. The tax credits include up to 50% of eligible access expenditures that are over $250, but less than $10,250, and up to $5,000 per tax year. Note that eligible access expenditures include the cost of interpreters or other auxiliary aids and services. There is the link for the tax incentives for business. The web link on the ada.gov website is included on the slide and in the accompanying materials. Families can be the ones who bring this information to the attention of healthcare providers who might not know about these tax incentives.
Slide 46, the title of the slide is Policies and Procedures, Develop, Train, and Implement. Private and public healthcare providers are encouraged to enact internal policies and procedures that address the specific communication needs of the entity and the patrons that they serve. Involvement of people with disabilities and families in this, and also potential advisory board members for the organization. Parents may need to cue or even provide a brief informal type of training to the medical staff. For the young lady Olivia we spoke of, she often will stand at the doctor's check-in window with her ID card or insurance card, and oftentimes the staff will bypass Olivia and look to the parent to get her checked in. Olivia is trying to communicate with the doctor's staff, but the staff isn't aware of her type of communication and therefore needs a little training from the parents.
Slide 47, ADA.gov logo is at the top, and the title of the slide is Information and Technical Assistance on the Americans with Disabilities Act. This slide shows a screenshot from the United States Department of Justice website entitled Barrier-Free Healthcare Initiative and includes the link to the settlement agreements under this initiative. Slide 48, the title of the slide is Barrier-Free Healthcare Initiative Settlement Agreements. There's a list by state of 5 cases in the southeast region of the United States that resulted in settlement agreements. In general, the healthcare providers or facilities agreed to provide auxiliary aids or devices and or to not retaliate against people with disabilities who bring forward a complaint. Slide 49, the title of the slide is Sensory Disabilities Resources National. There are logos of the national organizations listed on the slide. The listing of the national resources includes their websites. The resources are the American Council of the Blind, National Federation of the Blind, National Association of the Deaf, and Registry of Interpreters for the Deaf.
Slide 50, the title of the slide is Healthcare Resources National. The logos of the National Healthcare Resources are on the slide and include their websites. The resources are American Academy of Pediatrics, Association of Maternal and Child Health Programs, National Center for Medical Homes. The AAP has both information for medical professionals and their families. It's geared more for professionals, but also has informative news articles from breastfeeding moms returning to work to the effects of e-cigarettes. AMCHIP, AMCHP, has information from historical background on Title V to useful information on topics such as health reform and transition. Medical Home website is a great resource site with info on building a care notebook to informative videos about medical homes and working with professionals and more. Slide 51. The title of the slide is Healthcare Resources National. The logos of the National Healthcare Resources are on the slide above. Family Voices and Transition. The National Family Voices site can provide publications and resources on many topics for families and children with special healthcare needs. Transition has resources and tools for the transition from pediatric to adult health services.
Slide 52, the title of the slide is ADA Resources National. There are logos of the ADA National Resources listed on the slide. The listing of the resources includes their websites. The resources are the United States Department of Justice main page and revised ADA requirements on effective communication, the ADA National Network and Southeast ADA Center materials on accessible healthcare and accessible medical diagnostic equipment. Slide 53 is titled ADA Disability Resources Tennessee. The logos of the Tennessee organizations are listed on the side, the Tennessee Disability Coalition and Disability Rights Tennessee. The listing of the resources includes the websites. The resources are Disability Etiquette, Engaging People with Disabilities, Effective Communication in Medical Settings, and Effective Communications Overview.
Slide 54, the title of the slide is Healthcare Resources Tennessee, with the logos of Vanderbilt Kennedy Center. The links to the resources include Healthy Bodies Toolkit, Healthcare for Adults with Intellectual and Developmental Disabilities, and also a healthcare training link. So providers know how to effectively communicate with individuals with intellectual disabilities or developmental disabilities. There's a link to the 8 training modules between 5 to 13 minutes each, and they can be viewed at any time in any order. Slide 55, the title of the slide is Contact Information. There are cartoon pictures of a walking question mark and a figure holding a key. We thank you for joining us today, and we have recorded this webinar, and we'll have it available on our website. We will email all of you to let you know when it's posted, as well as sharing that through the listservs and social media. If you have questions, here's our contact information, and we encourage you to email or call about any questions about today's topic or other questions about resources for you and your child with special health care needs. Remember, the key to good health outcomes is effective communication between you and your provider.